Wow. Thanks, Rev1, for making me follow those two amazing entrepreneurs. So if I screw up, it's not my fault. Hi, my name is Joe Anstein. I'm here to talk to you guys today about trueDOK. Before I get into what makes trueDOK special, I'd like you to hear from one of our customers first.
Hi, I'm Dr. Minnie Somasundaram. I'm a general OBGYN in Columbus, Ohio. I'm in a practice of 5 physicians and 3 nurse practitioners. What led us to be interested in the application was that our billing staff would spend hours a day trying to sort through what the cost was for an individual patient. There's so many choices in healthcare nowadays in the context of insurance that you have to sift through all that information to try and give your patient the best information they can get. The goal of our practice is to be a service practice, and the financial burden that patients are faced with interferes with that. Several of the benefits that we've experienced with trueDOK are patient satisfaction because they're aware of what their expense is before they come in, and also a reduction in time that the staff spends in doing much of the legwork, the pre-certification that is currently now done electronically rather than manually.
So there's a major sea change happening in healthcare today, and it's being almost completely driven by the rise in high deductible plans and other insurance plan complexities. Let me illustrate. 10 years ago, when you went to the doctor's office, they looked at your insurance card, they identified and collected your copay, and from that point forward, practice staff dealt almost entirely with insurance companies to collect payment. But now with the rise of high deductible plans, you, the patient, are now responsible for a higher percentage of the bill. In fact, the average American family now has an annual deductible amount close to $8,000 a year, and the doctor's left chasing you to make up the difference. Doctors also have to get what's called a prior authorization from insurance companies prior to performing almost any procedure or referring a patient to almost any specialist. This is a very complex problem, and it costs the U.S. healthcare industry nearly $31 billion a year. Not so simple. Because you, the patient, are now responsible for more of the healthcare bill, you are demanding greater visibility into the services that you are being provided from a cost perspective. Because the doctor is now paying more money than ever before to administer care to patients, they need to know that you're covered, that you can pay, as well as create efficiencies around other patient processing tasks. For this reason, we've created trueDOK. trueDOK is a HIPAA-compliant software as a service that helps both patients as well as physicians with price transparency, bill payment, as well as creating or automating complex patient processing tasks such as prior authorizations. Let me show you how we do this. Welcome to the new age check-in experience. Regardless of how or when a patient engages with the physician, they'll be able to, in real time, confirm that the doctor is in network, calculate the out-of-pocket expense for a patient prior to an appointment, as well as validate their detailed insurance information. As you can see, the patient experience just got a whole lot better. They feel informed, in control, as well as satisfied with the process right from the get-go. For those patients that need procedures or referrals to specialists, practice staff can quickly fire off an electronic prior authorization request right from trueDOK. We have automated the submission, tracking, and ultimate determination of both procedure and referral prior authorizations. With our real-time determinations, practice staff can receive approvals in real time, as well as be quickly notified when any additional information is needed in order to obtain that prior authorization. Our users are projecting significant time and cost savings, as they'll now be able to perform these prior authorizations in 1 to 2 minutes compared to the 45 to 60 minutes it currently takes them to do today. But there's one more thing. When the patient goes home, they can log on to trueDOK.com, which is the one place they can go to manage the entirety of their healthcare. Think Mint, the financial services for healthcare. They can go there to see detailed pricing and insurance information for their entire family, even if they're on different insurance plans or see different doctors. All of this information is available, but it's fragmented, and we're bringing it together to benefit both patients as well as doctors. We are initially rolling this out to both physician practices as well as surgery centers, There are over 240,000 physician practices in the US and over 5,500 surgical centers. Now you know the what and the why, now it's time to meet the who. Meet Team trueDOK. My name is Joe Anstein. I'm a co-founder, experienced entrepreneur, as well as been solving data integration challenges like this for Fortune 1000 companies since BI was a baby. This is my partner, Dr. Amol Arora. He is a co-founder as well. He's the chairman of the OBGYN department at Mount Carmel. He's an Ohio Health staff physician, as well as an owner of a physician practice. Together with our secure data integration expertise, combined with our deep understanding of the physician practice wants and needs, there's no better team out there equipped to solve today's challenges. Thank you for your time. I look forward to speaking with many of you after the presentations.